Thank you, Doctor, for introducing me. I'll be speaking about how we mitigated COVID infection in NHPC and our journey from day one. NHPC is fully committed to stand with the nation in this moment of crisis and has been putting its all-out efforts to fight COVID-19 pandemic. We started initially with a lecture on COVID-19 at corporate office for its employees by a pulmonologist from Fortis Escorts Hospital, Faridabad, in the first week of March. Then we sent one of our doctors for training with the first batch of master trainers in Delhi government on 9th March, where apart from detailed training in regard to COVID-19 appropriate behavior and treatment plan, training material was also provided to disseminate the knowledge among its doctors and the general population. Then subsequently, a pan-India webcast was organized where one of our doctors and an expert on infectious disease control from Apollo Hospital, Delhi, shared the platform to inform all the employees and officers in regard to COVID-19 appropriate behavior based on the guidelines of Ministry of Health and Family Welfare. In addition, in the consequent date, we organized a program through video conferencing for our doctors and paramedical staff, wherein the detailed treatment plan and doffing of the PPE kits and how to dispose it through the biomedical waste management was shared with them. And then an awareness on coronavirus infection was shared with all the employees and others through display of posters, banners in all our locations, which continues till to date. And we also gave training to our security guards, contract laborers, housekeeping staffs, canteen staffs, and others in regard to the new guidelines and what they have to follow. And then all the employees were asked to download the Arogya Setu app. And during this training program, we also gave training for basic life support training for our security guards in our organization, and shared with them how to do the hand hygiene cleaning techniques through the Suman K method so that they are able to register it quite well. And in all our projects and power stations, which are located in hilly remote locations, since it was very difficult to arrange for all the medical items and all the PPE kits during complete lockdown, an urgent requirement was jotted and emergency procurement was done, and it was dispatched, and we dispatched PPE kits and 95 masks, disposable surgical masks, surgical gloves, thermal scanners, and some hospital equipments also through road. And in one of our projects, which is located in remote locations in northeast in Manipur, with the help of Manipur House, where they helped us in sending it by air. This is how we made we divided it for different locations and put it on a road. And with our limited resources, we set up quarantine and isolation beds with oxygen cylinders and concentrators. About 375 beds was set up, and consultation with the local district COVID-19 authorities. NHPC management advised all its power stations, projects, and regional offices also to extend all possible help and quarantine facilities for the local population. Here we arranged for food items, for sanitizers, for PPE kits, and whatever help we could extend to the local population, it was done. We too had some patients among us. We had COVID-19 infections many were asymptomatic, some were symptomatic, where there were mild cases, moderate cases, and severe cases. All of our doctors, 24/7, were giving consultation through telephonic mode and were sending prescriptions by WhatsApp, and a detailed data of each day it was taken and sent across to our director and chairman, who was monitoring it, and our ministry was also monitoring it. So we were into not only giving treatment, we were also helping in other ways. For mild patients, we were giving them medication on prescriptions. For moderate cases where we were monitoring the patients, we were asking them to jot down their temperature, SpO2 levels twice a day, and if they were diabetics or hypertensives, we were checking with their parameters, and if there was any problem or if the SpO2 was falling below 90, we chose to shift them to the tertiary care hospitals or to the empaneled hospitals. In between, there was a severe problem for the for availability of hospital beds, but somehow we managed with the help of the empaneled hospitals as well as, and all our doctors were in coordination with these doctors from empaneled hospital. We managed all our patients very well. We had some casualties as well. We must have, I think, managed about 600 odd patients, and there were, I think, one serving employee we lost, and we lost few retired employees, but otherwise most of them managed to get through well. This is when in one of our projects in Leh and Kashmir, which is remotely located, there was a patient who had to be shifted for acute respiratory distress syndrome. This photo you can see is from our project at Kishanganga, which is located in Bandipora in Kashmir, where the patient was shifted through Medanta Hospital Air Ambulance. In Leh also, we tried to shift the patient. It took us nearly 3 days to shift the patient because of the weather forecast and the weather problems. There was a lot of turbulence. It was very difficult for the plane to come, and finally we took help of Air Force to shift the patient from Leh to Chandigarh, and from Chandigarh an Air Force, I think Apollo ambulance was on standby, and they picked up the patient and brought them to Delhi, where the patient was taken care of. In Leh, the patient had developed, she was a known case of valve replacement, and she had developed stroke. So she had to be brought to the tertiary hospital. And here too, this patient recovered. Both the patients have recovered and they are back to normal. And we arranged for 5 days webinar training series on COVID with the help of Public Health Foundation, the second week of April, followed by a training program for all our paramedical staff. And continuous webinars have been being organized for both doctors and paramedical staff to keep up to date on COVID and other diseases. We also took approval from competent authority for teleconsultation services for our doctors as well as specialists and super specialists from various government and empaneled hospitals for the benefit of NHPC serving as well as retired employees and their beneficiaries. We must have arranged for convalescent plasma for our seriously ill patients who needed in different tertiary care hospitals, and we were helping out for the public also as such, those who were known to our employees or their relatives. Many of our recovered COVID patients gave plasma to these patients. We arranged rapid antigen screening test twice with the help of ESI hospital and the state government authorities in Faridabad, and antibody testing was also done for our employees with help of an empaneled hospital. And NHPC also has been contributing in preventing the spread of COVID through various initiatives and distribution of food packets along with PPE kits and sanitizers, disinfection drives, creation of quarantine facilities, providing portable ventilators for ICU, crash cart, emergency recovery trolleys, blood analyzers, ultrasound machine, anesthesia workstations, etc. And all my team of doctors have been providing 24/7 medical services during this pandemic. These are some of the photographs. And during our raising day, 46th raising day, we organized a blood donation camp with the help of Rotary Club, and state government blood bank at different locations in our in India, wherein we must have collected more than 900 units of blood. NHPC has set an example of harmony amidst lockdown to fight COVID-19 by arranging food, medical checkup facilities and medicines for hundreds of Nepali citizens who were stranded in Dharchula in district Pithoragarh in Uttarakhand due to sealing of Indo-Nepal international border. Under the able leadership of our Honorable Union Minister, Shri R.K. Singh, NHPC, along with other CPSUs, took leading role in providing essential goods to the people of Ara and Bihar during lockdown. These items were portable ECG machines, X-ray machine, cardiac monitor, cardiac ICU beds, infusion pumps, suction machine, nebulization machine, CPAP, auto analyzers, rapid antigen test kits, etc. This is one of the disinfection, sanitization photographs of one of our projects. And on Government of India instructions, a task force was constituted in NHPC for providing cold chain equipments like ice line refrigerators, deep freezers, walk-in coolers and freezers to 4 states, that is Himachal Pradesh, Jammu and Kashmir, Arunachal Pradesh, and Madhya Pradesh for transportation, handling and storage of COVID-19 vaccines. Our Honorable CMD Sir, who had been guiding us throughout this journey, acknowledged our efforts and bestowed his blessings upon Medical Services Division in the form of an appreciation letter on Independence Day. Thank you very much.